Everyone, this is Mary Ann from the New York City Organization of Public Service Retirees. I want to show you a document that was sent to me this morning that was distributed by TWU Local 100, the Transport Workers Union, regarding misinformation around their health program, the Aetna Medicare Advantage Plan. So let's get right into it because this is another episode of Debunking Bullshit. Okay. So this document arrived in my email this morning, and it says when it comes to our health care, we need to know the difference between truth and lies. So wherever you see a yellow highlight, you already know, as from the years of us doing this, that our process is to debunk what's in these documents. It is the best way for us to show where organizations are not telling you the entire truth. So right here, Medicare eligible TWU retirees have been covered since January 1, 2024 by the new top tier health care package negotiated by local 100 leadership. So you're absolutely right. It was negotiated by TWU local 100 leadership, but it is far from top tier. And why is that? Well, let's get through this. So you have a new association director, Jimmy Whalen, who I've tried to call. This will now be the second time I've tried to call him. First was right after he was elected, not appointed, I guess. He was not elected. There was never an election for this organization. Right after he was appointed, and he never called me back then. I sent him an email. He never responded back. So today I called him again and I said, hey, listen, I would like to debunk one of your documents. I want to talk to you about this. Statements that you're making that are not true. I want to give you the opportunity to clear the record. So if I don't hear back from him by the end of the day, I'm going to make this video live. So he says, Whalen and Retirees Association manager Barry Roberts blame the confusion on two things. And they're referring to the plan statements being made by the retiree group that's defending their benefits. It says there was some confusion at the beginning, says Retirees Association Director James Whalen, but we have made a big effort to make sure our retirees understand the benefits of their great coverage under Aetna options 1 and 2. And today we only get a few calls from members about Medicare coverages. That's a big improvement. But here's the deal, Jimmy. Here's the problem with this. Not everyone's going to call you. You are no longer their union, and many of you are not even in your association, and they don't have to be. Who are they calling? They're going to be calling Aetna, or they're going to be complaining to other retirees or their doctors because they're not getting the care that they need. And we have proof of that. So he goes on to say, Whalen and the Retirees Association, Barry Roberts, blames the confusion on two things. One, city union retirees, most notably from the teachers union, filed a lawsuit against the union and the city of New York over changes to traditional Medicare in their contracts. That first sentence is a total lie. First of all, the New York City Organization of Public Service Retirees represents 250,000 retirees from every city agency in the city of New York. We are not just teachers. And we are not most notably teachers either. I'm FDNY. So he also says that this is over changes to traditional Medicare in our contracts. There is no contractual language in our contracts regarding healthcare because our healthcare is statutory, meaning there's a law that requires the city to pay for our health benefits. What you have is contractual, and that's where your benefits have been diminished. Two, he says a small group of TWU retirees, calling themselves TWU 100R, claimed our benefits had been reduced and tried to draw a comparison of our benefits to city unions. That's also false. TWU 100R is the organization that was founded to fight to protect their access to traditional Medicare and their CPPO plan, which the union negotiated away. Right there, that is a diminishment of a benefit. And they're not comparing themselves to what the city has. They're comparing the Aetna Medicare Advantage plan to the traditional Medicare and CPPO and the design of both of those plans, the construct of what they have access to. Further highlighted area says Whalen and Roberts believe that intentional misinformation spread by the TWU 100R caused a lot of damage. Why? Because this group used the TWU's good name as part of its group's branding, which created an impression, most likely intentional, that they were part of Local 100 or the Retirees Association. They are not. Well, then basically what you're saying is then the union negotiated a benefit for someone not in their union. Isn't that illegal? Unions are only allowed to bargain for wages, hours, and work conditions for those in their units. By the union negotiating away a benefit for people that earned it, that are no longer in the union, then they're representing people that are not in the union and taking away their benefits. That sounds like a diminishment to me, Barry and Jimmy. TWU retirees, any New York State public service retiree, is not in a union. And even if you're not part of a retiree association or you are a part of a retiree association, it doesn't give the union any more ability to negotiate for someone that's not in the union. Even if you're a dues paying retiree to the Retirees Association, the union still has no legal basis to negotiate for you. So when they negotiated away the health benefits for a retired worker not in their union, that's an improper practice and a violation of law, which eventually their court case will address. We hope we'll get to that point, but that's another video. But they did actually diminish their benefits, and they negotiated away their access to traditional Medicare. He says they also spread more lies that our benefits have been diminished. They haven't, said Whalen and Roberts. They remain outstanding. Our benefits are superior to the city unions. Now, we know this is not correct. We've won 10 times in court, 2 unanimous appeals decisions. The judges have so far all agreed with us that Medicare Advantage is not Medicare, and it's not an advantage. You have a narrow network. You have prior authorizations. These are not things that you had in traditional Medicare with your CPPO. By them offering you perks like a debit card or rides or frozen meals, these are at a direct trade-off to healthcare. Continuing, it says another fabrication coming from the TWU 100R group concerns doctors or hospitals not accepting Medicare or Medicare Advantage, said Whalen. Some doctors or hospitals go in and out of network quite often when insurance contracts come up for renewals or providers open up negotiations. This is nothing new. Now, you're twisting the facts here. When a hospital or doctor have a negotiation, and typically this is hospitals with the insurance company, have a contractual negotiation over whether they're going to accept their plan and what the reimbursement is going to be. If this isn't a Medicare Advantage, and like in your situation, the doctor has to accept Medicare in order to accept Medicare Advantage. The doctor can't accept Medicare Advantage and not Medicare, okay? So your statement here says that this retiree organization is spreading rumors about hospitals or doctors not accepting Medicare or Medicare Advantage. Right there, that tells me Whalen doesn't know what the hell he's talking about. In order to be in a Medicare Advantage plan, and in order for a doctor to accept the Medicare Advantage plan, they have to accept Medicare. If not, they're not a Medicare accepting doctor. Hard stop right there. He says about this renewal. The renewal issue isn't the issue we're talking about. It's the contractual issue. It's not that doctors are dropping in and out. It is that they're coming out of the network in large numbers around the country. This is well documented, not just by Health and Human Services, the Office of the Inspector General, the Department of Justice, CMS itself. And here's a fact you can rely on because we've used this in our case against Aetna as well. 99% of doctors in America accept Medicare. I want you to ask Aetna today how many doctors in the country accept the Aetna Medicare Advantage plan. They can't tell you 99%. I'm going to tell you that that number is more likely at about 80% of doctors in America. And I will tell you also that that number is dwindling. And how do we know that? Because back about 8 months ago, there was a group that we pulled together of many unions and their labor union attorneys. When we were asked to provide documents together, we collated a group of documents that showed in the number of states where transit worker retirees are, how many doctors were there in the network over the last couple of years, and how many there were when we did this review. The number is dwindling. And more doctors and hospitals are not accepting Aetna Medicare Advantage or Medicare Advantage in general. And there's many reasons for that. Medicare Advantage plans have to undergo prior authorization because the insurance company is for profit, and that's the only way that they make money for their shareholders. So in order to make money for their shareholders, they have to delay and deny you care. That doesn't exist in traditional Medicare. And traditional Medicare was one of the greatest civil rights achievements in America. It allowed anyone to go to any doctor or hospital as long as they accepted traditional Medicare. So in this plan that you have, you're absolutely confusing the issues. You're not understanding that a doctor negotiating a contract or one that says, I'm done, I'm not taking this anymore, or no, I refuse to take this. The last part I highlighted is the provider must be in Medicare A and B. The last sentence says the provider must be a Medicare A and B provider and bill the plan. That's not entirely accurate. Yes, they have to accept Medicare A and B, but it's not that they have to bill the plan. They have to accept the payment from the plan. If the doctor says, I'm not billing that plan and I'm not accepting their payment, that doctor's not in the network. Now, where this becomes an even greater issue is when you have doctors that are not accepting the plan for payment, but they are accepting traditional Medicare. You now, as the patient, you have to call Aetna and say, I want to go see Dr. Barnabas. And Dr. Barnabas accepts Medicare, but he doesn't want to accept your crappy ass plan. If you don't make that phone call and get Aetna's approval that you can see that provider, if Aetna reviews the bill when you submit it for reimbursement, because you're going to have to pay that doctor upfront, when you submit the bill for reimbursement, they may not reimburse you. And they're in their right, according to their contract, if they find that that visit that you had was not medically necessary, they don't have to reimburse you. And if you're in one of the plans that has the out-of-pocket cap, it doesn't get included in that cap either. That is purely out of pocket. And they're not telling you this. So now I want to go further down. And what they did was they put testimonials from 5 different people here in this document. So what's interesting about this is they're sending this document, I'm assuming, to active workers or to let them know that the retirees are spreading misinformation, but they're not. These retirees are actually being used. These gentlemen on this document are being used to perpetrate misinformation. So you have Persis Mystery. He says, some doctors don't want to accept Medicare of any kind. He explains that he went to a doctor and during COVID, and the doctor didn't want to accept Medicare. It says, I went to a knee specialist and he said he wants nothing to do with Medicare because during COVID, he accepted it and Medicare didn't reimburse until 4 years later. I went to a new urologist and the lady at the desk said they don't take Medicare. I asked her to look at my card and told her that my union said you would be accepting Medicare. She looked at my card and then gave me an appointment. Most doctors do accept it. You have to ask them to look at the card, not just walk away. Now, this is a little conflated because if the doctor accepts Medicare Advantage, he has to accept Medicare. That's why it says the doctor has to accept parts A and B. This doctor, clearly, he's confused, didn't want to accept his Medicare Advantage plan. Not that the doctor doesn't accept Medicare. Medicare would have reimbursed him and it would have taken less than 4 years. It's the Medicare Advantage plans that pay around 4 years time typically because they're arguing for reimbursement, which is why doctors don't want to accept them. Then you have James Cornick. I'm a retired bus operator, 31 years on the job. I worked out of Manhattanville and Quill. Lower down in this paragraph, it says, quite frankly, it bothers me to hear misinformation about our coverage coming out of some people up in New York. I have no idea what their motives are spreading these lies. Well, James, I'm really disappointed that you would take for granted something that someone said to you without vetting it. See, that's why we exist. We debunk bullshit all day long. So you live in a state where you may have better coverage than other people, or your doctors may, the ones that you are currently seeing, accept the Aetna Medicare Advantage plan. That's not the same for everyone. We have other situations, which I'm going to get to in a moment, where there are retirees from transit whose doctors and hospitals aren't accepting them. So while this plan may work for you, it doesn't work for everyone, which is why traditionally unions, including TWU Local 100, offered their retirees a choice of plan. And it wasn't until recently that they forced everyone into the Aetna Medicare Advantage plan, because by doing so, Richie Davis was able to extrapolate the value from the retiree health program and put it into his contract, which he's admitted several times. So you need to face that fact, James, because that's exactly what he did. And just because your doctors are in this plan doesn't mean that everybody else is. And because they were forced into this plan just like you are, but you're happy, they are not happy because now they are forced into a healthcare plan where their doctors and hospitals do not accept their insurance. Mike Bulla says he retired in October 22. He has no problems with the Advantage plan. All of his doctors accept it. In fact, some of my copays even went down. Well, kudos for you, Mike. I'm glad you're happy. Other people are having a harder time. They're having to pay out of pocket for their doctors. That didn't happen under traditional Medicare, as like I said, 99% of doctors in America accept it. Aetna cannot say the same thing. Michael McGrath, he then says he had 30 years on the job starting in 1978 as a cleaner. He says that around January 1st of 24, he went to Columbia Presbyterian and he had a cancerous tumor in his intestines. And he's had no problem with this plan. Well, Michael, I'd like you to meet another journalist, Luis Uribe, who lives in Arizona, who went to go to Mayo Clinic for his health issues, not just for his cancer, but also for his treatment for his joint disease. Mayo Clinic doesn't accept Medicare Advantage. I have another retiree that lives in Florida, had to go to Advent Health, needed a transplant. They don't accept Medicare Advantage either. We have doctors around the country who are facing the same exact issue. God bless you that you're happy with it, but you should also acknowledge that there are retirees where this plan is not working, and allowing your former union to use your voice as a reason to advocate for forcing someone into a plan just because it works for you isn't union solidarity, brothers. We have to identify that there's a problem with this plan, because one day maybe your doctors and hospitals won't accept it, or maybe you need to move somewhere like closer to your kids or somewhere else where those doctors don't accept it. But if you were on traditional Medicare, you would have had no problem. Acknowledge that fact other than this, because here, TWU Local 100 is using you to perpetuate a lie that everyone is happy and they're just complaining. Why would they be complaining? Maybe you should speak to the lady who needed an implanted defibrillator because her heart was bad. And Aetna Medicare Advantage told her, and yes, she is a TWU retiree, told her, I'm so sorry, we're not going to give you that defibrillator. You're going to wear this vest. And if there's some reason that there's a problem with your heart, hopefully that vest will shock you and bring you back to life. And you're going to do that for 90 days. And then we're going to give you a test called an echocardiogram. And if after that we decide, in our opinion, it's medically necessary that you need to have this defibrillator, well, then we'll make that determination then. And what happened to her? Well, a hurricane came through her area. She lost her electricity and she couldn't charge that damn electric vest. So you guys need to understand that this plan doesn't work for everyone. It's not a one size fits all, which is why your union always offered better health care. And you are being used by your union to harm other union brothers and sisters. Face that fact, gentlemen. Mark, Persis, James, Mike, Michael. All of you have been used to try to convince other people that this plan is beautiful, and what's being told in court or by a group of retirees who are being harmed by this plan is not true. And you just became part of this mystical machine of propaganda, union propaganda, so that Richie Davis can hide behind the fact that he reduced benefits. At one point in time, your union had an HMO plan that you decided not to keep. It's an HMO. Most people don't like HMOs because you're required to use a network. Well, guess what, fellas? This plan is exactly that. While it says that any doctor can accept this plan, any doctor can. The fact is, they don't. And when they don't, and they won't accept the plan for payment, you have to pay that doctor and submit the bill to Aetna and hope that they reimburse you. And that, gentlemen, isn't healthcare. And when you're sick or infirm, should not have to battle an insurance company to get care or struggle to find a doctor. Luis Uribe lives in Arizona and he has to travel an hour further to get to a doctor that accepts the Aetna Medicare Advantage plan. Are you okay that a fellow union brother retiree has to travel in his 70s an hour further to another doctor that will take the plan when, if he was on traditional Medicare with the CPPO, it would have been accepted by a doctor within 5 miles from his house? And that he doesn't have to worry about going 8 weeks begging for treatment when he would have gotten it right away. If you don't understand what's happening in this plan to other people, you really need to find out before you allow your voice to be used for misinformation and propaganda. Because the lives that you will affect may one day be your own. And knowing that your voice contributed to harming somebody else who stood with you in union solidarity, that is a disgrace. Understand you're being used. And shame on Richie Davis and TWU Local 100 and for their e-board for allowing this to happen. To say that there's no diminishment of benefit when you are in a plan that is designed to prevent you from having that access. Traditional Medicare doesn't do that. And Richie Davis did this strictly to pull out the value of your health program and put it back in the contract for active workers. He sold off his retirees to fund a contract wage. That is a fact. Have a great day, everyone. And remember, the next time your voice is being used, make sure it's being used properly and you vetted what you're saying and for the reason why you're being asked to say it, not just to support your former union president because you like the guy. Make sure that what you're saying isn't going to hurt somebody else. And if you don't know for sure, maybe you should listen to the other side to find out if what they're saying actually has some truth, as in this case, it absolutely does.